My name is Anil Rajendra. I'm a cardiac electrophysiologist with Alabama Cardiovascular Group at Grandview Medical Center. Today I'm just going to talk a little bit, very briefly, about atrial fibrillation, or Afib, and a potential treatment option. So Afib is the most common abnormal heart rhythm that we see as cardiac electrophysiologists or cardiologists. It affects well over 6 million people in the U.S. and projections are that number is going to increase to over 10 million in the next few years. So it's a very common arrhythmia that can cause a lot of symptoms for patients. There are a lot of different treatment options that your physician can discuss with you. And one option is a procedure called an ablation, or an Afib ablation. And this is a minimally invasive procedure where you go through the veins in your groin and run catheters up into your heart, and then we target the areas that typically cause Afib. The main triggers for Afib are the pulmonary veins. The veins bring the blood back from the lungs to the heart, and so we will target those veins by using different sources of energy. You can either use cryoenergy, which is freezing the heart tissue, or radiofrequency energy, where we heat the tissue and essentially burn the tissue. And using those different modalities, we create a thin line of scar tissue in the areas that we're targeting to hopefully prevent the electrical signals that are initiating or starting Afib, to keep them from getting into the heart and keep your heart from going into Afib.